afternoon, Miss Hanson. I'll be doing your postpartum vaginal delivery assessment. I know you've had a 20-hour-long labor, so I know you're exhausted, so I'll try to make this quick. Congratulations on the little girl, by the way. I understand this is your fourth child and fourth girl, so congratulations. So with any assessment, of course, first and foremost, I'm going to start out with vital signs, pulse, blood pressure, temperature. I'm going to assess her skin, make sure there's nothing going on, no redness, no tenderness anywhere. Hers is going to be a little different, obviously, because she just delivered a baby. So I'm going to be more in detail than I normally would, and just make sure there's no complications there. Make sure there's no breast tenderness. I understand you said you did want to breastfeed. So I would ask how that was going. I know in the past you've had trouble with your children latching on. Is that any different this time, or? Okay. So she said her little girl is doing better than her other kids have been doing. But you're still struggling? Yeah. So she's still struggling a little bit with that, which is completely normal. It's all, of course, new to the baby, and not exactly new for her, but every child's different. So I'm sure if you keep on that, maybe she'll get the hang of that. So 9 pounds and 10 ounces, okay. Had an episiotomy. Okay, so I would, of course, ask her if she's in any pain. I'm sure there's discomfort down there from all the trauma that she's been through today. How is your pain level today? Okay, it's not too bad. She said she's just exhausted, which obviously I would be too. I wouldn't say the main thing, but a very important thing after giving birth, I would want to stay on top of my pain control. Make sure if I have any medicines ordered to be getting those on time for sure, because I would get ill with my child and ill with all the nurses if I was in a lot of pain. So just be sure to stay on top of that, and I feel like that'd make everything else flow easier. Okay, all your vital signs look really good. Your temperature is just slightly elevated. That's normal. I would keep a check on that and just make sure it doesn't continue to rise. That would possibly mean there was an infection somewhere, so obviously I'd want to keep a check on that. Okay, I guess we can go ahead. I'm just going to pull this down, go ahead and expose you. Do some hand hygiene. Okay. So I'm going to feel around you, just tell me if it's tender anywhere. I'm going to start around the edges and work my way down. There's no redness, no cracked nipples, anything like that. Does that feel okay? Good, 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 good. Okay, so I'm just going to move my way down and feel up the belly. Okay, fundus is in place. It's firm in midline, so that is awesome, right where it needs to be. Okay, I'm going to go ahead and pull this back up. Have you had a bowel movement yet? No? Okay, that's completely fine, normal. So she has Colace ordered. I advise all my patients to take that around the clock, just as it's prescribed, because being constipated on top of everything else, especially with an episiotomy, is not something fun or that you want to go through. So I would for sure take that. Drink lots of fluids. I'm sure you were starving after being in labor for 20 hours, so have you been eating okay? Good deal, good deal. But like I said, just continue to drink lots of fluids. Between that and the Colace, I want your bowel movements to be completely back normal as soon as possible. I would ask how my patient was emotionally attached to her baby. It said that this was her fourth girl, and she was, I guess, looking forward to maybe a boy, so I know that was probably a little depressing, but I know she was still excited about having a baby, so it's just tricky. Not that she's disappointed to have a girl, but I know sometimes, of course, we want boys and girls. I would ask her how she's doing with that. Her husband is in the military. They haven't been able to get in touch with him. So I would ask, do you have, a close friend, family, somebody that you can kind of cling to, a good support system while your husband's away? Good, good. I know it's not the same as having him here. Hopefully they'll be able to get in touch with him shortly and y'all can call or FaceTime or something. I know it's still not the same. Having a good emotional and support system is just as important as anything else, with really anything, but especially with labor, because that's a tough thing to go through by yourself, and it's still even tough to go through with a partner, spouse, friend, but that's super important, because postpartum depression is real, and it affects people of all ages. You never know when it's going to hit you. So it's really important to stay on top of things, to talk to people, to make sure you have lots of help. I know you have 3 other kids at home, so are they of, an older age to, okay, of all ages. Good deal. So you'll have some extra help with that too. They might be more harm than help, but hopefully not. Okay. And I know you said you haven't had a bowel movement. Have you been urinating regularly? Okay, been quite a few times. Okay, that is awesome. I want to stay on top of that. Make sure, I know I said drink lots of fluids, just make sure you continue to do that. So you'll keep going to the bathroom like normal. Let's see. I forgot to look at your pad a while ago to see how it was. So I'm going to do that now. I've already felt your belly, your breast, all that. So I'm just going to assess this real quick. I'm just going to go ahead and expose you here. I already felt, but none of this is, of course, tender, but it's not excruciating pain. Okay, good deal. If you would, I'm just going to have you roll to the side. I'm going to check your back side, your bottom, for hemorrhoids, anything like that. Okay, all that looks good. I'm going to roll you back. Okay, look at your pad. There is a little bit of discharge, but it's nothing abnormal. Just a little bit of light blood, but you don't have any, pain other than the normal. Okay, good deal, good deal. Want to stay on top of that, check that regularly, make sure that her pad doesn't suddenly become soaked, that she doesn't have any sudden abdominal cramping, pain, anything out of the ordinary that would maybe indicate there was still blood left in there or anything left in there from birth, or that she had some type of postpartum hemorrhage. Keep a check on that, and for sure all her vital signs, make sure nothing decides to jump up or drop down low, no low blood pressure or anything like that. And you're going to continue to try and breastfeed. Okay, I think that's great, and that is awesome. If you're able to do that, I think that's good for both you and baby as far as emotionally, and it's just easier for one, so you don't have to worry about making a bottle. But if it doesn't work out, it will be a-okay, and I'm sure you'll get the hang of it. This is your 4th one, so this is obviously nothing new for you. I would overall just go back everything with my patient, make sure that they were comfortable as they could be. If there was anything that I could do, whether that be medicine-wise or emotional-wise, obviously if she didn't have anybody here with her, then I would try and spend some extra time if, my time permitted for that, obviously, just to be here, because like I said, this is a tough time, and I wouldn't want to go through it by myself. I would make sure my patient was comfortable. If she needed help, bathing, anything like that, and just make sure things were going to be good at home for whenever she did get discharged. She has said that she had help. She has kids, friends, that type of thing. And like I said, just make sure she stays on top of all her medicine, especially the colace, and drinking lots of fluids, because that's a huge problem that could easily be avoided as long as you stay on top of things. Okay, I know I mentioned that you were in labor for 20 hours, so I know you're exhausted, but I just had to come check on you, make sure everything was okay, make sure you were good, baby was good, so I'm glad to hear that. So thank you so much for your time. I'll be down the hall if you need me at all. Just give me a call, okay? Thank you.